Based on the diameter, remember the inner or the medial side, we don't want it to go here, but we don't want them to meet. We don't want them to be far apart because they're too far apart. The most aesthetically, most optimal, beautiful breast is when they're 3 centimeters apart. It looks very natural, gives her a nice natural cleavage. And then with this, now you have to say, okay, how much of the implant do you want to hit when you move your arm? Because if I put a larger implant, this is a larger implant, which means the diameter is a circle. So now this is further out, and then now it's going to go out to the side. So it's going to be hitting her as she's walking or she's jogging or doing her daily activities. Some women want a breast that is curving out to the side more. That gives them more of a voluptuous look. They don't want that, and they want it to be a little bit more torso or her chest, overall rib cage. That gives her more of a kind of an athletic, slender feel. And those are the decisions that a patient can have with their plastic surgeon to determine exactly. The important thing, you want to have a size that is comfortable for her, because also the wider it also goes further down, which means that you would have to release her natural crease further down. And further you release it, it distorts her normal natural anatomy. So we don't want to go too far beyond what her natural boundary of her lower breast is. But this is supporting structure. What we're doing that is very unique is that I'm creating that internal bra. Remember I told you about? So typically patients wear an external bra, but surgically, what I'm going to do is I'm going to create a tissue that's going to swing up. It's going to kind of swing out this way. And this fascia is going to be holding on to the implant so that she's not relying on an external bra for support. Because over time, what happens is that the implant will want to drop down, and women end up wearing a bra, like even at home after work or at night. Some people even wear it when they go to sleep because they're so worried that the breast is dropping. Whereas the internal bra will support it inside underneath her breast tissue, so she doesn't have to worry about that. And if she wants to wear a bra, she will do it just because she wants to, but not because she has to wear the bra. So that's another huge advantage. And we published this in our peer-reviewed journal on how we do that. And so we're not using any synthetic material to create this bra. It's using her own tissue.